All right, of course, it's still TVC breakfast. Now, we told you earlier we're going to be talking about the new outbreak of disease in Bayelsa State. That's the monkeypox. Well, the Chief Medical Director of the Niger Delta University Teaching Hospital, Professor Dimie Ogoina, has confirmed 13 suspected cases of monkeypox in Bayelsa State.
Of course, Professor Ogoina, who spoke with TVC News Bayelsa correspondent Ovieteme George, confirmed that one medical doctor is among those infected by the virus.
Of an outbreak of the monkeypox disease in Bayelsa first broke on the internet, but not much information was given until I met the State Commissioner for Health, Professor Ebitimi Tula Etebo, who confirmed cases in Agbura and Biseni areas of Yenagoa local government area.
We have an outbreak of monkeypox in Yenagoa local government, precisely in Agbura. That was the first where we saw the first index case in an 11-year-old boy. Some other cases from Biseni. We have mobilized through WHO, we mobilized all stakeholders, Nigerian Center for Disease Control, Afinet, and they are doing all that is necessary to ensure that we break the transmission of the infection.
News of the outbreak of the disease is already on the pages of national newspapers, but not many persons in the state are aware of its presence.
We keep seeing strange ailments in the world these days.
So you've not heard of it?
I've never heard of it.
Somebody just sent a picture of the monkeypox stuff in my phone. Like, man, it's funny, and I seem not to believe. But one should be very careful. We can't just say anything. We could be very, very careful. We should be very careful. If it's in Bayelsa, man, we just pray that God should help us.
I went to the Niger Delta University Teaching Hospital at Okolobiri, where the Chief Medical Director, Professor Dimie Ogoina, confirmed that some monkeypox patients have been quarantined at the institution.
This morning, we had 2 additional cases coming from town, and the second one apparently came from outside the state. We're still trying to investigate if the infection started outside the state or within the state. We have so far admitted about 5 patients. 3 of those patients have been discharged. They are doing well, including a medical doctor. So I believe we'll be able to contain the outbreak. So far, we have about 13 suspected cases now. Currently, we have 3 patients. We have not reported any deaths. The patient that came in about 2 days ago, she's doing well. She's a pregnant lady. She's doing well. She's getting better.
For an airborne disease that can be transmitted from an animal to human being or from person to person, the Chief Medical Director of the Niger Delta University Teaching Hospital, Professor Dimie Ogoina, wants people in the state to cultivate health practices that would halt the spread of the monkeypox virus. Ovieteme George, TVC News, Okolobiri, Bayelsa State.
All right, let's now bring in our correspondent Ovieteme George from Bayelsa State to tell us more about the outbreak of the disease. Ovieteme, thank you very much. What exactly, beyond what the Commissioner of Health told you, did anyone tell you the cause of the outbreak in Bayelsa?
These are, first of all, good morning, Obielu and Ngozi. These are technical things in the medical profession, and of course, they would, as much as they can, conceal certain things. They didn't feel it's necessary at this point in time for public consumption. But they were a bit friendly. I had access to the Niger Delta University Teaching Hospital, where I met Professor Dimie Ogoina, the Chief Medical Director. Now, I wanted to get evidence that actually there are patients there at the medical facility, the medical institution, the NDUTH, but they wouldn't let me go close to where the patients are, because they had been quarantined, and they told me it's not good for public consumption. That is the visuals. Even the hospital staff would not be comfortable anymore. They would be somewhat confused, when they see the visual of where the patients have been kept. So they, despite the cooperation, the questions and all we discussed, the place was just close by, but they said, no, I wouldn't go there. I was willing to be quarantined, actually, to go get visuals of those who have been affected, but they wouldn't let me. That was how far I could go. But so far, they haven't told me the reason for the cause of it. I could only get little information from the internet about how one can contract the disease. It could be from monkeys, rats, to a person, and then from person to person. And that this is where it comes in. One has to be careful.
Yes,
handshakes,
indeed.
body contacts because of body fluid.
Of course, we have a medical doctor who will be finding out exactly, what this disease is all about. In your report of Teme, we gathered that not many people are aware of this disease. As a matter of fact, many actually doubted when they received some kind of information on their phones. What kind of public enlightenment is going on in Bayelsa State to ensure that people are informed?
Yes, it's quite sad that many are not aware of it. But I must say I put myself in their shoes too, because 3 days ago I never heard anything about it. And I just saw on the internet somebody posted. I thought it was perhaps one of those rumors one could just easily discard over time. But when I saw the health commissioner, Professor Bitimi-Tula, he confirmed it. That was when I decided to go to the streets and then confirmed also that many were not aware. But somebody told me something, an unlikely source. I just looked at him, have you heard about it? And he said, yes. How did you hear about it? I heard it on the radio. That was how I got to know that the government has stepped up efforts to inform the public about the outbreak of the monkeypox disease in Bayelsa State.
All right, Teme George, stay on this. We'll be coming back to you, of course, from time to time to get the latest developments about this outbreak. Thank you so much for joining us this morning.
Thank you very much, Ngozi. You can always bank on TVC. That's where you work, first, accurate and reliable. We're staying on it. We'll give you much more information as it breaks.
Absolutely. Thank you so much. Well, our medical doctor, Tuyime Bawodu, is with us right here in the studio to enlighten us more about this. Here we are again. Another outbreak, monkeypox. For so many people, it may have even sounded like some prank by some joker somewhere. But tell us about this monkeypox outbreak. What exactly is it?
Yeah, thank you, Ngozi. So exactly, monkeypox is a viral disease. This is one of the viral diseases that actually, manifest in monkeys. Most of the time, you see that those diseases in those wild animals, they act as reservoir. They don't actually, show the signs and symptoms of the diseases. But for monkeypox, actually the rashes were seen in the monkeys in the 50s, late 50s, and then they have to take serum. And finally, sometimes they found out it was a viral disease in the monkey. Most of the time, the monkeys, rodents, squirrels, and rats can actually, be host to these things, and they actually manifest the disease, and then they can spread it to human. It's similar to smallpox. Smallpox was eradicated in about around 1980. The world finally was declared free.
Smallpox free.
From smallpox, but the key difference is the fact that the size of the rashes is bigger, and then the spread is not a typical smallpox spread. How does it manifest? The incubation period essentially is it can be as short as 6 days and can be as long as 21 days. That is when the virus enters, and then you are wondering when it's going to manifest.
That incubation period will, of course, have to do with the person's immunity?
Immune system. That's why you have that range. The virulence of the virus and the immune system of the person being infected. Now, the first thing usually is those what we call constitutional symptoms, fever, headache. But the key things about this monkeypox is the fact that the lymphatic system is targeted. The lymph nodes becomes enlarged. You see massive enlargement of lymph nodes, and then it spreads, and especially during the invasive period of the disease, okay, of the virus. The virus enters, and then we see large enlargement of lymph nodes. That takes about 5-6 days. Then after that, the rashes start appearing. The rashes are typically bigger than smallpox.
More like boils.
Yes, like boils. They're not as tiny as measles rash. So, and we see them first of all around the palms, and the feet. Okay, and then the thing now can now spread and take over the rest of the body. So the rashes have evolved to have pus, and then crust, and then breaks down, and then heals over some days. So that is exactly how it manifests. But good enough. It's not the fatality rate. Fatality rate is just about 1 to 10%, and it's not that deadly, as we say. But that is what we have.
All right, presently. Now let's look at how, I mean, the cause of it in those communities mentioned now in Bayelsa State. Could it be that the communities were affected by rodents, or that because they had monkeys around that brought about the spread?
Again, another pointer to the fact that of the intricate relationship between us and our environment. We've been seeing a rise in the cases of epidemics. It's not less of it, but we're seeing more of it. Why are we seeing more of epidemics? Simply because of environmental factors, ecological factors, and social factors. These are the things that are perpetuating the rise of epidemics regularly and frequently. And now, as long as we keep, spreading human settlements, without regards to the environmental condition, without regards to ecological condition, contacts between human and animals will keep, getting on the increase. And let's be reminded that what happens at the first time, there's a jump of these organisms from their reservoir to human. Okay. The only time you can get that jump is when you have contact with those animals. Either you hunt them for food. Is it just
physical contact, or actually eating? Like in the case of, we hear, I mean, some stories concerning this, that some persons actually ate monkeys, and from there they contracted the disease, and the rest of the community, of course.
Yeah, monkeys meat is a delicacy in some part of, Africa, and then it's hunted for food. Squirrels are hunted for food. Rodents are hunted for food. As long as you spread human settlement or you hunt these things for food, again, you are going to see quite increase the likelihood of this jump of these organisms from those animals to human. As long as you are involved in, extractive industry, trying to get resources, searching for these minerals, metals, and all those things, and then you have to enter the bush and do all those things, you are going to get this disease. As long as your health system is weak, and these are key issues, because they point out to the fact that we need to sit down and sincerely look at our health system. As long as you cannot do surveillance and pinpoint and pick those epidemics before they start, even at the level of the animals, you are playing with fire, as it were. You're going to see more of those epidemics. As long as people are poor, they cannot actually feed, and the immune system is compromised, and we have this bulging population of people that bulging population of youths that are not having anything to do. Yes. As long as you have those things, you're going to have epidemics.
Of course, poverty is a major, factor. All right, we'll take a quick break, and when we come back, we'll continue this discussion with Dr. Tuyi Mebawondu.
All right, and welcome back. Of course, it's still TVC Breakfast, and we are talking about the outbreak of monkeypox in Bayelsa State, and we still have Dr. Mebawondu here in the studio with us, taking a look at how, I mean, the modus operandi of the new disease, monkeypox. Doctor, well, in one of the one of the respondents, who talked to our correspondent in Bayelsa, apparently was, surprised, saying he hadn't heard about, monkeypox and all that. At this point, it has broken out already, and the government has his work, cut out for it. What more do you think that the government in Bayelsa needs to be doing at the moment in terms of sensitization, in terms of letting people know about it?
Let's first of all appreciate them for actually taking those immediate measures to try to curtail the thing and be responsive and bringing the information out. Key issues, key things that needs to happen in our health system is the health literacy campaign, which should actually be the first policy in terms of informing people, in terms of actually, setting up indices that can really peak epidemics and our preparedness for that epidemics. Okay, now, the health information is such that it has to go as local as possible. We must, take it down to the grassroots in the language people understand, at their cultural level and at their understanding. Because again, you can see that if we don't do that, we create room for ignorance, we create room for superstition, we create room for wrong reaction to such things. So
it's not enough for government to say, look, no cause for alarm.
No, it's not
people
sufficient.
Don't eat monkey meat, don't eat bush meat and all of that.
It's not sufficient. Yesterday, I was one of the panel discussants. Lagos State is trying to train the low cadre people to really do this kind of thing. And we're looking at it, we're discussing what is possible, what can be done. And it's important because now you need to recruit people at that local level that can quickly point out to those kind of things. They need to understand the interaction between them and the environment, why it is key to treat animals in a certain way and ensure that you don't really get, too much contact with them. Of course, at the root of this is food security, because as long as they're looking for protein and have to survive and eat and sell those bushmeat, again, they need to really get involved in those with those animals. As long as they have to fell trees, indiscriminately, then will get in contact with those animals. So again, the government mode of information should be such that people understand the dynamics of those diseases, so that they don't ascribe it to spirituality or demon. And then people know what to do, how to respond, in such a way that even those people that are trained to get good community, enlighten people on even simple hand washing and how to keep their distance from such illness. So it's important. And health literacy from every medium we have, we must be able to really push this health literacy.
And those campaigns, how should they be periodic or constant bombardment on radio, on TV, that when a new outbreak happens, this is what you do, this is what you don't do, and all of that? I wonder how that will help.
Because it does appear it's only when these outbreaks happen that you hear, like when Ebola happened, and then there was a campaign, wash your hands, get sanitizers, and all of that.
Yeah, again, we need to heighten this campaign and make it a more permanent thing.
Yes.
It's not like a campaign, it's a complete literacy thing.
It should be a culture.
Yes. It's a culture with us that we should look at it and say that, listen, here we are. We have weak health system, we have challenge with human resources for health, we have challenge with funding for epidemics as it is, and even health generally. But these are the things we can do that are cost effective for us to deal
and it's
with
even more disheartening
epidemic.
when we hear that the samples of this virus had to be taken to a World Health Organization lab in Dakar, Senegal. That's an African country, and the giant of Africa does not have that. All right, we'll have to leave it there. Dr. Tuyi Mebawodu, thank you so much for joining us.
My pleasure,
on TVC Breakfast. Hope the next time we see will be some good news.
Not another outbreak. To come and discuss the outbreak again.
It's tough to work in newsroom. It's always bad news.
All right, we'll take a break and return with more on TVC Breakfast. Stay with us.